Hi, my name is Dr. Ross Hauser. Welcome to Caring Medical Florida. Today I'm going to talk about how upper cervical instability can affect the brainstem. As you guys probably already know, you have the spinal cord, then the spinal cord enters the brain through the foramen magnum, then it connects with the brainstem. The brainstem then of course connects with the brain. But what a lot of people don't realize is there isn't some magical thing that happens in the foramen magnum. Like a person's brainstem could actually be below the hole in the head, and it could actually be in the cervical spine. So that's one reason that the brainstem can be affected by upper cervical instability. Another thing that can happen is cervical instability can cut off the blood supply to the brainstem, which is the vertebral artery. So in the office here at Caring Medical, we actually do blood flow scans of the vertebral artery called transcranial and extracranial Doppler. So our ultrasound machines can measure blood flow through the vertebral artery, and then we can move a person through a range of motion to see if the blood supply goes down. So that's been really innovative. The brainstem, the lower part of the brainstem called the medulla oblongata is where the vagus nerve, the glossopharyngeal nerve, the spinal accessory nerve, and the hypoglossal nerve all originate. So upper cervical instability by causing a decrease in neurologic function of the lower part of the brainstem, it can affect those nerves. So those nerves control swallowing, control hearing, control balance, control even how your tongue moves, speech. So upper cervical instability can affect all of those functions. Interesting too is the nausea center is right in the lower part of the brainstem, and you'd be amazed at how many people just feel nauseated all the time and nobody can tell what's causing it. You know, they go to gastroenterologists and various GI doctors, and they would have no idea that the cause of it is upper cervical instability. What's kind of interesting to me too is how many of my patients who, once they get their upper cervical instability resolved, their heart palpitations and their arrhythmias go away. I'm not saying every arrhythmia is from upper cervical instability, but the lower part of the brainstem is what controls basically heart rate and blood pressure. So somebody who's having, tachycardia, all of a sudden, boom, 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 and then it goes away, and then they go to the cardiologist, and they can't really figure out what arrhythmia it is. It could be that the person is just having upper cervical instability affecting the center in the brainstem that controls heart rate and blood pressure. The brainstem, the lower part, also affects respiratory rate. There's people that all of a sudden feel panicky. They start breathing really hard, or they have shortness of breath and they don't know why. Well, it could be that they have upper cervical instability decreasing the function of the brainstem. The cervical instability from ligament injury causes the cervical curve to change from a normal C curve to the opposite. You actually get a reversal of the curve. The reversal of the curve causes a stretching on the spinal cord. It's as if it's yanking the whole brain and the brainstem down, and that traction on the brainstem can also affect brainstem function as well as cranial nerve function. So to get the brainstem and all the nerves working correctly, one has to tighten up the ligaments in the back of the neck, as well as get the cervical curve back to its normal lordotic configuration. The way we do that at Caring Medical is by prolotherapy. Prolotherapy is an injection technique that stimulates the tightening of ligaments. We also do a process called cervical curve correction with weights. I'm just going to get them now. So what we might do is we might have somebody, wear a certain weight system, which again would help them regain their normal lordotic curve. Obviously, when they have to work on a computer, we would encourage them to actually be looking up at the computer to try to get back their normal lordotic curve. By tightening the ligaments, restoring the normal lordotic curve, function of the brainstem gets back to normal and their symptoms go away.